So I'd like to think, at this point, that most of us realize that the war on schmugs hasn't really made anyone safer. But just in case you need a little more evidence, here's a really interesting study. Researchers in San Francisco looked at records that showed schmug seizures from law enforcement and schmoverdoses, and they found something really wild. If you've never seen me before, I'm Emma. I'm a science and medical journalist, and I'm particularly passionate about medication assisted treatment and addiction recovery. I'm working on a book about methadone. If you're interested in that sort of thing, make sure you hit the follow button. Anyway, so one day after law enforcement had seized schmugs from a particular location, people within 100 meters of that location were more likely to schmoverdose. That's the size of a football field. And that elevated risk for a schmoverdose lasted for 7 whole days. So just to reiterate, anytime that law enforcement removed schmugs from the street, within 7 days, more people in that area were unalived by schmugs. Here's how the study authors put it. The findings of this cross-sectional study suggest that the enforcement of schmug distribution laws to increase public safety for residents of San Francisco may be having an unintended negative consequence of increasing schmopioid schmoverdose mortality. To reduce schmoverdose mortality, it may be better to focus on evidence-based health policy interventions.